Baringo County are doing very well infrastructure-wise. Across the 7 sub-counties, we even have extra 50 facilities which have been constructed and never operationalized because of lack of human resource and equipment. Now, on issues to do with HRH, that is human resource for health, that's where we have a problem. I think you have 1344 healthcare workers against a population of 760,000 in 11,000 kilometers square service area county. And that is where the challenge is. We discovered that there was a communication breakdown between us, a service delivery, the executive, and the legislature. There's been a myth that the Department of Health is well funded by the partners.
We had forums where we engaged with the department. We were able to take the members of the county assembly, particularly the budget and appropriation committee and the health committee, through the priorities of the county. We had partners who came to support. They supported the department and we were brought in.
One of the way forward was actually to consider us for a phased implementation plan where staff were to be absorbed in phases. It was a very fruitful discussion where we discussed quite a number of issues, and they agreed that they are going to actually support us by putting in a budget to hire to employ staff.
At the end of our 2-day interaction advocacy meeting, they were able to understand that partners are just there to support the systems, but they are not funding the Department of Health directly.
I would say the advocacy strategy has worked. Members of County Assembly was brought on board with the department, and they were able to bring out the gaps in terms of the financing. And through that advocacy, there has been an effort to really put more resources into various programs in the department.
And so far, we have 3 MCAs who have responded by putting a budget. 3 MCAs from 3 wards. One is Aimo Gipsaraman, who has put a budget of 2 million. We have another ward, known as Martabo ward, who have also put a budget of 2 million. And then lastly, Kapropita ward, who have put a budget of 1 million. So considering a total of 5 million in total, which is still not bad, but we believe going forward, if we can have more MCAs, everybody putting in our budgets. Okay, the budget actually comes from the Ward Development Fund, where they sit to the 190 and they discuss. They can actually collapse some of the budgets for projects and do maybe hiring of staff.
So during our advocacy meeting that we had early this year, I outlined the infrastructural plan, the cost of the infrastructure, human resource requirement, equipment for the new hospital complex, some fittings and installation, liquid and solid waste, plus furniture for the facility. And I'm pleased to say that we had quite a huge impact after that advocacy meeting. The county assembly has actually allocated 130 million in phase 1, that is for this financial year, towards the equipment of the new facility.
Personally, I want to appreciate Iro for the support in terms of health system strengthening. It's been actually excellent in terms of even that advocacy meeting, which we really appreciate, because Iro was with other partners able to bring us together for a 2-day meeting. And actually, apart from Iro supporting us for the meeting, they had a chance to explain clearly their role in terms of partnership, and even our legislature was able to appreciate and actually understand the boundaries between the partnership, the primary roles of the department, and even the stakeholders supporting the department across.